All right, hey guys, we are learning about the knee this unit. So I'm making this video so you can watch it and see my face whenever you want. So let's go ahead and start with the bony anatomy, and then we'll do some bony landmarks going into ligaments and non-bony tissues, and talk a little bit about muscles as well. So to start, we've got two major bones that make up the knee joint. Bone number one is the longest and strongest bone in the body, the femur. This guy right here. From a posterior view, it looks like this. You got your two big condyles and epicondyles, and then you have your tibia, which we learned about when we talked about the foot and ankle, the tibia, the shin bone, right here. So those are the two bones that actually make up the knee joint, in addition to the patella, which actually in this model is underneath the soft tissue here. So this is the patella, or the kneecap. Again, when we talked about the patella, we talked about how it sits in the patellofemoral groove, which is, if you move this out of the way, this little notch here in the femur, the patella sits right in there, and that's how it tracks when the knee flexes and extends. It tracks through the patellofemoral groove. So we've got the patella, the kneecap, the femur, longest and strongest bone in the body. Then we have the shin bone, or the tibia, right here. A bone in this region that you'll see here on the lateral side is the fibula, which we also talked about in the foot and ankle unit, but this is not actually part of the knee joint. It's just in that region, so we can't really forget about it. So fibula, not part of the knee joint, but it is in the same region and is going to play a factor in where muscles and ligaments attach. Okay, so speaking of ligaments, let's talk about those bad boys. We've got two collateral ligaments and two cruciate ligaments that we're learning about in this class. Ligament number one is the lateral collateral ligament of the knee, the LCL. It attaches from the femur to the fibula right here, and it prevents varus stress. Okay, varus stress. This is the LCL preventing varus stress on the knee. On the opposite side, on the medial side of the leg, we have the MCL. It actually has two bands. You guys don't really need to know that for my class, but it is a thick ligament with two bands, the MCL on the medial side of the knee, preventing valgus stress, like this, valgus stress. So that's inward bending of the knee, as where varus stress is an outward bending of the knee. Okay, so those are the two collateral ligaments on either side of the knee. If we look at a posterior view, we can see the two cruciate ligaments. This one right here, attaching from the femur to the tibia, is the PCL, or the posterior cruciate ligament. It prevents posterior displacement of the tibia. And then the ACL, you can see here, if we open this up a little bit more, it creates kind of an X pattern. The ACL is in there as well. That is the anterior cruciate ligament, preventing anterior displacement of the tibia. Okay, so you can see that here. Anterior displacement of the tibia, posterior displacement of the tibia. You can see that in the posterior view. Anterior displacement of the tibia, protected by the ACL. Posterior displacement of the tibia, protected by the PCL. Okay. And you can see the posterior view of the LCL and MCL as well, protecting against varus stress for the LCL and protecting against valgus stress for the MCL. As we learned about in class, ACL tears are relatively common, especially in female soccer players. MCL tears often will be associated with an ACL tear, and those are pretty common as well, because valgus stress is a lot more common in sports than varus stress. LCL tears are less common, but they do occur. And then PCL tears, I would say, are the least common in sports. We actually see those more in car accidents. But the PCL is the primary stabilizer of the knee. It's a really, really tough, strong ligament, so you don't see those too often. So those are the ligaments associated with the knee that we're going to learn about in this class. Next up, we have our medial and lateral meniscus. This is the lateral meniscus, and this is the medial meniscus. You can see those if I open up the knee joint like this. They are semicircular fibrocartilaginous little discs that create a supportive base in the knee, providing cushion and allowing the knee joint to glide smoothly when it moves. They provide some shock absorption and make sure that we don't have bone on bone contact. So these menisci are really important, and we're going to talk about those in class as well. So we have 2 of those, medial and lateral. Then we're going to talk about tendons. The 2 tendons that I really want you guys to worry about are the patellar tendon and the quad tendon. Quad tendon is going to be up here. This is a common tendon for all 4 of the quad muscles to insert at, and then it comes and runs all the way down to the patella, and it's kind of contiguous with the patellar tendon. Patellar tendon is right here, connecting from the tibial tuberosity, which you can see here, this little bump on the tibia, the tibial tuberosity, and it connects here to the patella as well. So you've got the quad tendon connecting the quads to the patella, and then you have the patellar tendon connecting the tibia, tibial tuberosity, to the patella. And these kind of run together in one common sheath. That's one thing that we talked about in class, is that why is this patellar tendon called the patellar tendon and not the patellar ligament? Because the patellar ligament would mean ligaments connect bone to bone, and this seems like it connects bone to bone to me. The bone here, the tibia, and it connects to the patella, which is also a bone. So we could argue that this patellar tendon could also be referred to as the patellar ligament for that reason. Now, it is commonly called the patellar tendon because it does run contiguous with the quad tendon. So people argue that, no, it's actually bone to a muscle or bone to a tendon, not strictly bone to bone. So you can argue either way. I think that pretty much wraps up the knee for now. We're also going to learn about bursa in my class, but those are not present on this model. Let's just mention muscles for a second because we are learning those in the class. The muscles that we learned today are the quad muscles. We have the vastus medialis, vastus lateralis, rectus femoris, and vastus intermedius. Remember, those names are they're aligned with where they are on the body. So the vastus lateralis is on this lateral side. The vastus medialis is on the medial side. The rectus femoris is the biggest and longest and strongest one that crosses the hip joint and is the first one, the biggest one in the front. Rectus means straight up and down, so it's straight up and down here on the quad. And then underneath that in the middle is the vastus intermedius underneath the rectus femoris. Okay, and all four of those extend the knee. And the one thing that's special about the rectus femoris, because it crosses the hip joint, is that it also flexes the hip. Okay, so the other 3 just extend the knee, and the rectus femoris extends the knee and flexes the hip. So those are the quad muscles. On the posterior side, we learned about the hamstring muscles today. So we've got the semimembranosus on the medial side, the semitendinosus on the lateral side, and the biceps femoris, which has 2 heads and inserts also on the medial side. So we've got, remember, biceps femoris, semimembranosus, and semitendinosus. All 3 of those are hamstring muscles, and those all flex the knee like this. We also learned in the ankle joint that we have the gastrocnemius, that is the primary plantar flexor of the ankle. But the gastrocnemius also goes past the knee joint up here, and so it has function in knee flexion as well. So the gastrocnemius also has function in knee flexion as well as plantar flexion. And then last but not least, I forgot to mention the sartorius. We also learned about that in class today. The sartorius is also on the anterior side of the leg and helps with knee extension. It has a couple other functions too, but for my class, you're only going to learn that it helps in knee extension. It's the longest muscle in the body, originates on the hip at the ASIS, and goes all the way down past the knee joint into a common tendon called the pes anserine, which you guys do not have to learn from my class, but it is kind of interesting to note that it is so long that it goes from the hip all the way past the knee down here. That is the sartorius. I think that just about covers it. I hope that this is helpful to you. Please let me know if you have any questions or concerns. Thanks.